Opioid overdoses, a crisis raging on during the COVID-19 pandemic.
People who were already struggling, their situations are just exacerbated by this pandemic.
In March, Erie County saw 28 suspected opioid overdose deaths. That's 7 times more than the average.
The people that we're talking about today that we're losing is a different population. We're talking about a working population that is unemployed. They're at home. The checks and balances that were in place aren't there. No one's looking for them because they didn't show up to work.
Acting Niagara County Sheriff Michael Filicetti says before this year, there was a decrease in overdose calls. But that number skyrocketed since January, including a 185% increase in March.
A huge spike like that, I would equate that to people that are, stressed, financial situations, they're relapsing, having hardships facing their addictions.
Rewind to December 2019, and opioid overdose deaths fell for the first time in a decade in New York State. By mid-March, the Centers for Disease Control announced overall overdose deaths decreased by more than 4%.
Cheryl, why do you think there's an uptick in these suspected deaths right now?
I think it's people are alone. There's nobody there.
The message remains unified. There is still help, even during this time of isolation. You are not alone.
We've really been getting the message out there that people need to have naloxone in their homes. They need to check on their family members, check on your friends. If you haven't heard somebody, speak to them.
Cheryl Moore, director of the Opioid Task Force in Erie County, says outreach continues. Telehealth is an important tool in this fight as programs like Never Use Alone, Buffalo Matters, and the 24/7 Addiction Hotline remain open.
We want people physically distanced from one another, but we don't want you struggling on your own, and there's help available.
Evergreen Health is also open, operating crucial services like the syringe exchange program and counseling.
I don't know if people feel because they're secluded in their home that help is not still available. It is.
And the acting sheriff pledges to continue outreach for his residents.
We can't forget the other public health issues, one of our biggest ones.
Nikki Dementry, 7 Eyewitness News.